Hello there, welcome to your routine dental appointment, I believe. So we've signed you up to this practice, and before I inspect your mouth, just have a few questions to run through here. So, when was your last dental examination, please? And have you ever had any dental work performed? At the moment, are you having any problems with your teeth, gums, or mouth in general? Any problems chewing, swallowing your food? Okay, and do you smoke at all? And do you drink? How many units per week about? Okay, and how many times a day do you brush? Do you floss? Do you use mouthwash at all? Right, so that's the case history. Let's get you in the dental chair and pop some glasses on and have a good look at your mouth, teeth and gums. Okay, so are you feeling comfortable in that position? Excellent, then we'll make a start. Now, throughout the test, I'm going to ask you to wear a pair of protective glasses. So, if you pop those on for me, please. Okay, do they feel comfortable? So let me pop on my gloves. First thing I'd like to do is a little feel in the mouth. Now this forms part of the cancer checks that we always start off with from the get-go. So if you can, open your mouth nice and wide, please. Okay, just lift the tongue to the roof of the mouth. Tongue to your right. And tongue to the left. Okay, just follow. And open wide again, please. Okay, let's place this just on the tongue. Just say ah, and again, and once more. Thank you. And relax. So I don't have my assistant with me today. She's off sick. So I'm going to be taking written notes myself. Thankfully, no lesions found. But I will have a look with some light, checking for any discoloration or hyperemia in the mouth, as well as other problems. In fact, I'm going to place my spectacles on, if I can locate them. There we go. Right, open wide again, please. Steaming up a little bit there, so let's get rid of those. Just have to come a little bit closer. So the soft tissue there, hard tissue. Just raise the tongue to the roof again. Tongue to the right. And to the left, please. Tongue in the centre of the mouth, nice and flat now. So that completes the cancer checks, all nice and clear. You'll be pleased to know. Also had a look at the uvula as well. Seems fine. Right, here's a dental mirror. Let's have a look at the rows of teeth now, open wide. So you have 8, 7, 6, 5, 4, 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8. 8, 7, 6, 5, 4, 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8. Just a little chip on the lower incisor. Does that bother you at all? Absolutely fine. Okay, open wide again, please. Alright, just bringing the light into the equation as well. Lovely. Okay, open your mouth wide again. I'm just going to lower the lip there and check the gums. Just move your head there, thank you. Just behind the front row I felt there was a little bit of plaque. And the top lip there. Excellent, thank you. Relax. So this is my model. The mouth, of course, we have slight overreach on the top right there, that's normal. Just on one of the bottom incisors in your mouth there, we have a little bit of a partial chip, but that's not bothering you, so I can leave that alone. And just behind the same teeth at the front there, there is a little bit of tartar, so I can give that a little bit of a clean for you. The gums seem to be in good condition around the mouth. teeth are fairly white, but as I say, we are going to give them a little bit of a scrape and polish today. Right, before we do that, I just want to check the bite patterns of the teeth using some special material. So I'm going to place these in different parts of the mouth. Just gently bite down when I say so. So open wide, please. Okay, and bite down. Excellent. Open wide and gently bite. And again, open wide and bite down there. Excellent. So you don't grind your teeth, as far as you know, do you? Okay, bite down there. And once more, just bite there, please. Thank you. So those are your bite patterns there. So those will be photographed and recorded on your record. 5 bite samples. Record. Right. Okay, this is my little scraper. We're going to do things manually today. So if I just set that up there, that's it. Now it's not going to hurt, but I'm just going to first probe the gums adjacent to the teeth, and then I'm going to perform a little bit of a scrape. So open wide, please. And the bottom row. 7, 6, 5, 4, 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8. Lovely. I'm going to hold my breath a second. Excellent. So we have a little bit of blood at the front. May have to improve our care regime. Right, I'm going to ask you to mouthwash before brushing. Then I want you to floss, and I would like you to brush your teeth afterwards, please. Right, let's begin with a little scrape. So open wide, please. Excellent. Have a moment, please. Okay, open wide again. Okay, I'm going to use this device next. Just doing similar work. You do very well. Okay, have a moment. And open wide again, please. Excellent. Relax again, please. Okay, one more device here I'm just going to use. Excellent work. Okay. Right, we're going to do a manual polish next. Okay, I'm going to apply some special solution onto the scrubber here. Okay, if you're ready, open wide again, please. Excellent, have a moment to go. And let's resume. Okay, wonderful. Right, I think that's everything today. Let me take those vases off for you. So, as I said, I'm going to see you in a year, but I want you to follow my care regime for optimum oral health. Now, unless you have any questions, I'm going to let you go now.